Addressing the mental health and psychosocial needs of populations affected by crisis has become a prominent concern in international humanitarian assistance. In 2021, the Asia Pacific Mental Health and Psychosocial Support MHPSS Training and Learning Collaborative was jointly established by 3 parties: the IFRC Asia Pacific Regional Office, the IFRC Reference Centre for Psychosocial Support, and the Hong Kong Red Cross branch of the Red Cross Society of China. The collaborative has been assisting national societies in terms of capacity building, responding in emergency, and establishing the Asia Pacific MHPSS network, a platform for knowledge management and information sharing.
We're sitting in a region that is the most disaster prone in the world, and of course the pandemic has caused additional needs around mental health and psychosocial support. Clearly, the mental health status of populations have and continue to be severely affected by the secondary health effects of the pandemic. So bearing in mind the size of the region, the complexity of the region, the disaster profile of the region, and of course the big negative effects that the pandemic has had on Asia Pacific, the collaborative has brought enormous value.
The Hong Kong Red Cross started to develop our MHPSS for the local community 18 years ago. At the same time, we also sent delegates to different emergency missions and built up our network and friendship with other national societies in the region. All these experiences and networks helped us to contribute to the Asia Pacific MHPSS collaborative.
After the collaborative was established, we can see that we have a much bigger impact. They use the tools and the methodologies developed by the Peer Center, but we would never be able to train so many people, reach so many in emergencies, and participate in so many assessments either. So we shouldn't underestimate what it means.
This collaborative will continue to support national societies to develop their MHPSS, adapting to their languages and cultures, and to better serve the communities, especially in terms of emerging needs due to COVID, growing migration, and climate change.
The general feedback, in fact the overwhelming feedback from national societies and colleagues has been that it's a unit, it's a collaborative that has brought enormous value right across the spectrum, both from the pandemic but also from the perspective of natural disasters, such as the recent volcanic eruption in Tonga, where mental health and psychosocial support was a priority for the national society and indeed for the response.
They are now the golden example for a regional hub. In the future, I believe that we will have regional hubs in each of the regions. Now we can learn from them and see how much it can benefit a region. They can teach the rest of the world a lot.
Mental health and psychosocial support has become a growing priority in emergencies and disasters globally. Asia Pacific region, being one of the regions facing the most natural disasters occurrence, is no exception. The collaborative will continue to serve and prepare the national societies to face more upcoming challenges and to bring mental health and psychosocial well-being for all individuals we serve.